Hello, you've just returned home after endoscopic carpal tunnel surgery. I would like you to take a few minutes to watch these post-operative instructions to ensure you have a smooth and quick recovery. Post-surgery pain is often described as mild. Hand numbness is normal during the first few days and is caused by temporary swelling. In most cases, pain and tingling symptoms associated with carpal tunnel syndrome subside within 48 hours after the procedure. As pain tolerance varies highly from one person to another, you can manage your own discomfort using the following pain medications: Tylenol, ibuprofen, and narcotics such as oxycodone. You may combine them as long as you respect their maximum dosages. Check with your pharmacist for interactions and contraindications. The goal is to prevent the pain before it starts. Keeping it under control is essential to be able to participate actively in your recovery. You should stop taking your prescribed narcotic pain medication as quickly as possible to avoid side effects, such as constipation or nausea. You should never drive while taking narcotic pain medication. These exercises can help you relieve discomfort after surgery. Raise your hand or both hands if you had bilateral surgery above heart level to help promote venous drainage and reduce swelling. Elevate your arm completely over your head to help minimize swelling faster. Repeat a few times every day for the first 4 or 5 days. You may apply ice on the surgical area, use a cloth or a Ziploc bag and apply for 15 minutes at a time to avoid burning your skin. The surgical dressing covering the incision can be removed the day after the surgery. Keep the Steri-strips in place until your next visit. You may notice some dry blood under the surgical tape, which is perfectly normal. You can protect the area with a Band-Aid for your comfort. You may shower and wash your hair the first day after surgery. Pools and jacuzzis should be avoided completely. Bathing is permitted as long as you keep your hand out of the tub for the first 2 weeks. You should abstain from doing dishes or working in the garden. Be careful around animals. Make sure to protect your hand in order to avoid infections. The incision should heal in about 10 days. You must start exercising your wrist, hand, and all fingers immediately after surgery. The nerve has been released and we want to prevent adhesions and scarring. As soon as you get home, you should move your fingers, hand and wrist to their fullest range of motion. Close and open your fist, then bend and extend your wrist while flexing your elbow. Slowly move your hands around. If you can, try joining your hands together in a yoga-like pose. Repeat 10 to 12 times, 3 times a day until your next appointment. These exercises might cause some discomfort. Do not hesitate to take your pain medication before to ensure you do them properly. Icing the area after will also help ease the pain. Do not use stress balls for the first 4 to 6 weeks. Resist the urge to do push-ups for at least 6 weeks. Driving is permitted as soon as you stop taking your narcotics. Most patients can resume driving 1 or 2 days after surgery. When you may return to work depends on your occupation and how fast you recover. Do not forget your follow-up appointment, which will normally take place in about 10 days. This visit is important to evaluate your progress and discuss your return to work. Until then, you should contact us if you ever develop fever, pain, or notice unusual drainage or redness around the wound. Please do not hesitate to contact us if you have questions and concerns. I look forward to seeing you again soon.